you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
To GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'm your host, Cynthia, and happy Monday, everyone. And yes, I know you all are like, what the heck is wrong with your voice? I know, I sound husky AF, like it hurts to talk, honestly. But I'm not sick. It's not a COVID, it's not related to COVID. This literally happens to me around this time of year when it starts to get cold. And I honestly just think it's a mixture. It's been really windy here in Sacramento. I think it's a mixture of it being really, really cold and windy and just overdoing it with my voice. I mean, I teach like over 20 classes a week, fitness classes where I'm like exerting a lot of energy, exerting my voice. I have to yell and motivate the members who come to my class. And it's been like this, honestly, for like the last 4 days. Like I'm croaking, I can barely get a sentence out without feeling really winded. So if I pause a lot throughout today's episode, or you just hear like really heavy breathing, I apologize. You can turn down the volume on this episode a little bit lower for today. But I'm going to try my best to not, breathe really heavy or croak, but it's going to be a challenge today. So nonetheless, if you guys can get past the huskiness in my voice and just tune in to what I have to say on today's episode, then we'll all get through it just fine. For those of you who are just tuning in and who have never heard of me before, I usually do not sound like this. Naturally my voice is lower, but I'm not like this. Like I don't sound like I'm in pain. So again, I do apologize for the huskiness. I'm going to just try my best to bust this episode out, okay? So today's episode, I think it's a really important one, whether you're male or female. I think this is a topic of conversation that everyone needs to understand and listen to. Honestly, the future of birth control. I think men should really pay special attention to this episode, since I think it will broaden your perspective on what a woman truly goes through, when it comes to birth control. It's not just us popping pills every day and like, there it is, like there's all these horrendous side effects that women go through when they're on birth control. All these hormones that are being injected into our bodies. And I think men don't really understand all the troubles that women face while on birth control, just for them to, have sex without a condom on. And I'm going to be, this is a grown conversation, y'all. So if you feel uncomfortable talking about sex or talking about sexual health, women's health, then I'm going to be straight up. This may not be the episode for you. We're going to not talk graphically, but we're just going to be talking about sexual health and talk about sex. And if you are, I don't know, under the age of 18 tuning in, or if you're a parent who just, I don't know, if you just like don't feel comfortable talking about this in an open space, how I am about to right now, then again, exit out of this episode. But I think this is a conversation that everyone should listen to, even if you're under the age of 18. In my personal opinion, I believe that sex ed, the way sex ed is taught in our schools, is just not ideal. You know, in high school, I remember they would separate the girls and boys. Like when it was time to talk about sexual health, they would separate girls on one side, boys in another room. And I don't think that really serves a true purpose in really explaining to the youth about sexual ed, and especially about what a woman goes through in terms of sex and contraception and everything. You know, there's guys really don't understand the extent of what a woman's body goes through. And I think even women ourselves don't really understand much about our own like our own biological beings. So that's why I really want to discuss it on today's episode and just talk about birth control, and specifically talk about this bad ASS CEO. Her name is Saundra Pelletier, and how she's basically coming up and developing one of the biggest breakthroughs in birth control since the 1960s. So we're actually going to talk about the current state of birth control, where it's headed, and what Saundra Pelletier is doing with this new innovative contraceptive gel that will act as a birth control called Phexxi. So I'm really excited to talk about it, despite, trying to push through my current vocal stage. But again, I'm going to first start off this episode sharing a little bit about my own experience with contraception, or with birth control. So I think I started taking birth control at the age of like 16 or 17. And my main reason for initially taking it was for trying to regulate my periods. Back then, I had very irregular, heavy periods, and they were so excruciating and painful to the point where I was heaving over a toilet, to the point where my mom would have to pick me up from school or from work because I physically could not walk. Like, my cramps were so bad, I would feel it through like my toes. And I know some of you women are going to feel me on this. Not all women experience these types of cramps, but when I was younger, when I first started experiencing PMSing and like cramps, it was so bad, y'all. Like, so bad. That time of the month was literally hell for me. And my doctor recommended me to start taking birth control, the pills. So the pills were my first method of contraception. And again, it wasn't for sex. I wasn't sexually active at that age, at the time. I did it for the sole purpose of trying to just regulate my insides, regulate my periods, my monthly periods. And then once I started to become sexually active, I started trying like different methods. So like I said, I started with the pill, then I tried the patch. But I didn't like the patch. Was easy to use. I will say that it was easy to use. You basically can manipulate when your period starts. So say you have a trip coming up and you're not trying to be on your period that week, you can keep the pad or the patch on for that week so that your period doesn't come, or you can make it so your period comes earlier. You can, in a sense, not to overcomplicate the conversation right now, on the patch you can manipulate your period. But I just didn't like that it would show, because you would have to place it on visible spots, such as like your shoulder, your arm, your butt, your hips. And it was like if I was wearing swimsuits or going on vacation, like you don't want the patch showing. So again, start with the pill, then the patch, then went back to the pill. Very on and off since I was 16, 17 years old. And then I finally ended up with the implant in my arm called Nexaplon. And the biggest side effect that I received with this one was that I was nauseous for like the first 6 months. I've had Nexaplon now for about 3 years, and it's been great actually. I haven't experienced any side effects, serious side effects, except those first 6 months when I was very, very nauseous. But what does trouble me and what is always kind of in the back of my mind is, these are hormones that I'm injecting into my body every single day since I was 16, 17 years old. I'm 25 now. So I've been on birth control for about 8-9 years, and it is worrisome, that I don't really know how this is going to affect me in the future when I do want to try and get pregnant. Like, will it cause my sex drive to go down? Will I have infertility issues? Will I have cancer? I mean, these are all things that kind of pass through, that are always like in the back end of my mind. Sure, I take it now because to prevent pregnancy, of course. But there's all these hormones, all these unnatural things happening in my body as a result of birth control. And we'll get into more detail after this commercial break.
Are you looking to learn more about the latest trends from the fitness world? Are you confused by all of the different trends that are out there? The GSMC Fitness Podcast is the place for you. The GSMC Fitness Podcast is the place to come for people of all skill and interest levels. Join us as we explore the latest trends in the fitness world. Does that new exercise really work? Should I try yoga? Whatever your question, chances are good you'll find an answer on the GSMC Fitness Podcast.
What's up, you guys? Welcome back to GSMC Health and Wellness Podcast. So right before the break, I was kind of sharing a little bit of my backstory and my relationship and experience with birth control. The side effects is something that a lot of women, hate about being on birth control. So it's like I feel like we're kind of put up against the wall here. Like, okay, we don't want to be pregnant right now, so we take birth control, but then we don't want to experience all of those like very severe side effects. So what option do you choose? Right now, about 17 million women are not on birth control because they are sick of the hormones. They are sick and tired of feeling abnormal, not feeling like themselves. It's not just the physical symptoms we experience. It literally alters our state of mind. It's really crazy. Like, these are just hormones being injected into our bodies. So again, I'm mainly speaking for the women who, are just out of options. If they tried it all, they don't want to be experiencing any of those side effects. What else is out there? If you're someone listening right now and you don't agree with me and you're like, well, I'm on birth control and I'm fine, that's fine. This episode's not for you. This is for the women who are looking for an alternative, are looking for a better way to prevent pregnancy, but to do it in a little more natural way, without hormones, with no symptoms, no severe side effects, And that's where Saundra Pelletier's contraceptive gel comes into play, and why this woman is going to disrupt the condom and the pill. Okay, so like I mentioned, Saundra Pelletier's company, Evofem, is developing a contraceptive gel that could be the biggest breakthrough in birth control since the 1960s. When your job involves trying to bring to market what could be the biggest breakthrough in birth control since the pill, you keep your mornings predictable. Every weekday, Saundra Pelletier gets up at 4:30 a.m., trying not to wake her 10-year-old son while she slips into her workout gear, which includes a sweatshirt with the word bull S-H-I-T printed on the left shoulder. By 5, the 48-year-old single mom who lives about a half hour from the San Diego offices of her company, Evofem Biosciences, is on the phone, often with her investors in London. At 5:30, still on the phone, Saundra Pelletier exits her garage with a quick nod to the nanny who is on her way in. Half an hour later, she's at either CrossFit or Fitwall, where she can work all the major muscle groups in 40 minutes. As the cool-down session begins, Saundra Pelletier bolts, already en route to her next stop, in a triple soy latte from Starbucks. Since there are no locker rooms at either gym, she swings back home, the phone automatically clicking over to a waterproof speaker in the bathroom to clean up. Back in her car, she dictates emails to her assistant until arriving at the office by 8:30. We get quite a lot done, actually, she says. But there's always room for improvement. When Thomas Lynch, the chairman of Evofem's board and the head of Ireland's largest hospital group, asked what he could do to thank Saundra Pelletier for her work as CEO, aside from her stock, she responded by asking that a shower be installed at the office. "So what you're telling me," he said, "is you want something that lets you work more." She did. In Saundra Pelletier's list of priorities, her morning routine comes third, after only her son and her companies. That leaves her mom and her fiance, who's the founder of apparel company Athleta, duking it out for fourth place. Perhaps the reason Saundra Pelletier is so wedded to early morning certainty is not because of any deficiencies in her relationships with her loved ones, but because her company is dealing with a level of uncertainty that most startups and their founders will never contend with. "We've had a significant amount of failure," Saundra Pelletier concedes. That uncertainty may explain why, when everyone in her son's class at school had to say what their parents would like as a holiday gift, her son replied, "My mama would like a dirty martini." For Saundra Pelletier to achieve Evofem's goal of becoming a global leader in women's health, for its investors to see a return, and to potentially affect women from San Diego to Malawi, she needs to successfully commercialize what is now the company's only product, Amphora, also known as Phexxi, a new form of contraceptive gel that has yet to be approved by the U.S. Food and Drug Administration. Innovations in contraception, at least in the U.S., have in recent years been few and far between. Yet, according to the Guttmacher Institute, 45% of all U.S. pregnancies are unplanned. Since the introduction of the pill, many birth control advances have been new delivery methods for the same hormones that have been used for decades. But about 5.3 million women can't safely take those hormones, often because of previous sicknesses. Millions more simply don't want to be on hormones if they're only occasionally having sex. When a patient asks her doctor for a hormone holiday, says Kelly Colwell, a practicing gynecologist and EvilFemme's chief medical officer. We just hand them a bunch of condoms and cross our fingers. A new form of birth control that doesn't require a doctor to administer is used only when a woman needs it and is hormone-free would be a breakthrough. In a clinical trial, Amphora worked about as well as other contraceptive gels. It may also provide protection against chlamydia and gonorrhea. Unlike other gels, Amphora or Phexxi doesn't contain surfactants, which can cause irritation and make it more likely that a woman will become infected with HIV. And without hormones, Amphora doesn't produce side effects such as weight gain, depression, or nausea. This could be one of the biggest innovations since the first birth control pill in 1960. That would be enough to put EvilFemme on the path to becoming a billion-dollar company. The current U.S. market for contraceptives is estimated to be about $6.6 billion. About 4.5 million women who are sexually active don't use a contraceptive. Then there's the market for preventing sexually transmitted diseases. When I was doing my training, we wouldn't put IUDs in anybody, says Andrea Thurman, the director of Conrad Clinical Research Center at Eastern Virginia Medical School. Now we put them in everybody. It's very possible that 20 years from now, everybody will be using Amphora. Amphora also puts decision-making power squarely in the hands of women. The gel can be discreetly inserted via an applicator that looks like a small tampon up to an hour before sex. A woman's partner can be as involved or not as she wishes. This is for an empowered woman, says Saundra Pelletier, emphasizing she doesn't just mean in the U.S. Her plan, if she wins FDA approval, is to distribute Amphora in the developing world on a philanthropic basis. Pretty cool, huh? The drug development regimen in the U.S. puts entrepreneurs such as Pelletier in limbo for a terribly long time. The cost of bringing a new drug to market has been estimated at anywhere from $648 million to $2.6 billion, and the timeline can easily stretch to 10 years. Development of Amphora began in the mid-1990s, and the results of its first clinical trial were published in 1999. Saundra Pelletier is in what should be the very last stages of this particular form of suffering and hopes EvilFemme can bring Amphora to market in 2019. But there's no guarantee and it won't make the cut. If and when the FDA does approve Amphora or Phexxi, there's always a chance that women won't flock to it. If that happens, significant modifications to Amphora are pretty much out of the question. In the world of new drugs, startup mantras such as iterate and move fast and break things sound silly. A drug needs to be approved by the FDA, and after that happens, there's not much room for change. Some drugs just get one shot. Amphora is already on its second. We're going to come to a very brief break, and when we come back, more on Amphora, Phexxi, and Saundra Pelletier.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter, and download us on iTunes, SoundCloud, and Google Play.
Hey guys, welcome to GSMC, or welcome back, I should say, to GSMC Health and Wellness Podcast. So I really hope you guys are soaking in this background story I'm giving y'all on Saundra Pelletier. I think it's important to kind of understand how this is developing, her thought process, and everything in between. When Saundra Pelletier was in first grade, her mother started sending her to school in the kid version of a suit, blue trousers, and a blue button-up collared shirt with contrasting trim, with her lunch in a small briefcase. Pelletier begged for a lunch pail, like what the other kids had, but her mother told her, "Sandra, school is not about eating." Her mother's singular mission was to get her daughter out of Caribou, Maine, population 7,736. Pelletier was plenty motivated to leave. Her grandparents had outdoor plumbing, and her family was sometimes on food stamps. Saundra Pelletier went to Hudson University in Bangor and then got a job in sales in the women's health division at GD Searle, selling its birth control pills. On Sundays, she would map out the coming week studying doctor schedules, composing messages, and choosing treats for the doctor's staffs. I had this level of discipline that was like, here's the goal, here's how we're going to accomplish it, she recalls. She was awarded a top salesperson distinction and rose quickly through the ranks. When a colleague told her she would have to stay in her post for 3 years before she could be promoted, she corrected him. "Maybe you have to stay in your job for 3 years, she said. "I don't." She got promoted after 2 years. By the time she was 34, she was a vice president. But then came the mini midlife crisis. Early in her career, she had gone on a safari in Africa with a girlfriend. When the guide asked if there was anything else Saundra Pelletier wanted to see, she mentioned health clinics. "I kept remembering all these poor women," she says. "If they're given an opportunity to have access to contraception, they don't have to be poor." It was a very big reality check. She didn't think that her colleagues in women's health necessarily had internalized what women around the world were dealing with. Even in big pharma, it didn't seem that we understood the gravitas of it. When women can make the right decisions for themselves and their families, and how it impacted everyone they touched. We wanted to sell the product, says Pelletier. Saundra Pelletier quit her job and became an executive coach. "I had this fantasy that all my clients would be women," she says. "Of course, all my clients were men. Women just don't invest in themselves in that way." She got married. She wrote a book about women's empowerment. She was preparing to spend 2 years sailing with her husband and then discovered she was pregnant. Saundra Pelletier was shocked. Doctors had always told her she couldn't get pregnant. Now she was 37, and clearly they had been wrong. To Saundra Pelletier, the pregnancy felt fated, but this was not what her husband had signed up for. When someone isn't up for that, it's kind of a buzzkill, she says. She told her husband she was having the baby. He could stay or leave, whatever. Within 3 years, Saundra Pelletier had a toddler, a divorce, and her dream job. In 2009, she was recruited for a role that directly addressed what had been tugging at her all these years. Founding CEO of Women Care Global, a nonprofit that enables sustainable access to contraceptives in the developing world. She couldn't imagine doing anything else until she got a call in 2013 from an executive of a small healthcare company called Evomed, who was looking for some help marketing and commercializing a new contraceptive gel called Amphora. My first reaction was, I'm flattered. Now please lose my number, says Pelletier. But when she started researching Amphora, she couldn't stop thinking about it. Evomed was working on products in dermatology, pain relief, and menstruation, and had licensed Amphora from Rush University in Chicago. Amphora was in a phase 3 clinical trial, generally the last hurdle before a drug is submitted for FDA approval. Saundra Pelletier agreed to a 3-year consulting arrangement in which she'd write a business plan for the company, raise money, recruit talent, and prepare Evomed for an IPO. In return, Evomed would allow her to keep her position at Women Care Global. But more importantly, Saundra Pelletier managed to negotiate terms that could help her scale and accelerate her mission. Once Amphora was through the FDA gauntlet, Evomed would sell it in North America and Europe, but it would also give it to Women Care Global to distribute in the developing world on a philanthropic basis. 18 months in, it became clear to Saundra Pelletier that Amphora might never become a blockbuster drug as long as it had to compete for attention within a small conglomerate that had a smattering of unrelated products. She didn't think Evomed's employees had the necessary experience in women's health or the ability to work at the pace she demanded. It was everything in the kitchen sink, she says of the operation. No one was focusing on Amphora as the golden child. She approached the board with an unexpected proposal. Spin Amphora out into its own company and formalize the relationship between the new startup and Women Care Global as a public-private partnership, with Pelletier running it all. Not everyone liked the idea. Saundra Pelletier says one of Evomed's bankers and its lawyers objected to her proposed dual role. The way Pelletier saw it, if I were a man and I said to you that I'd built this amazing nonprofit and then started working to advance another product that could really help the human condition, you'd say, oh my God, what a great human being, she says. But because I'm a woman, you suggest I can't manage it all. Meanwhile, some of her staff at Women Care Global weren't crazy about the proposal either. Saundra Pelletier was equally blunt with them. She pointed out that it was becoming increasingly difficult for nonprofits to find donors. There wasn't many private sector companies willing to partner with nonprofits, which they often derided as being filled with bleeding hearts who can't make good business decisions. If we can get access to this product that we all believe is game-changing and we don't do it, then shame on us, she said. When skeptics accused Saundra Pelletier of going back to the dark side, she reminded them, more money, more mission, period. Saundra Pelletier became the founder of EvoFem Biosciences, focusing exclusively on Amphora. She persuaded Evomed's original investors to stay on board, took 0 employees with her, found new office space, and hired her own team, which included commercialization pros from major drug companies. The way I do things is different, says Saundra Pelletier. I need a very disciplined environment. In December 2014, Saundra Pelletier's team was hunkered down in a hotel breakout room in Washington, D.C., preparing to meet with the FDA. It was supposed to be a routine meeting, the kind any company has with the governmental agency before filing for approval. But Saundra Pelletier also had something on her mind that she was hoping to get clarity on. She had discovered that a portion of the patients in Amphora's phase 3 trial were outside the U.S., in Russia of all places, a move generally frowned upon by the FDA. We're going to cut into a very brief break, you guys, and when we come back, more on Saundra Pelletier and Amphora.
The GSMC Life and Happiness podcast takes you on a journey of exploration. We'll discuss tried and true methods alongside the latest trends of how to best live your life to its fullest and happiest. From psychology to meditation, science to self-help books, the GSMC Life and Happiness podcast will help you to discover what makes you happy and how you can live life being the best you possible. Download the GSMC Life and Happiness podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
What's up, you guys? Welcome back to GSMC Health and Wellness Podcast. Continuing on with the conversation of the future of birth control and its backstory. So right before the break, we discussed how Saundra Pelletier had something on her mind, but she wanted a little bit more clarity on, and she had discovered that big portion of the patients in the phase 3 clinical trial at Amphora were based in Russia, which is not, it's very frowned upon by the FDA. Not a good look. And more troubling was the fact that no one at Evmond was able to explain why the Russian sites were being used. Drug companies typically outsource their clinical trials to contract research organizations. In this case, it seemed that once Evmond hired its CRO, it didn't pay much attention to the details. We thought the head of the CRO was just a rock star in his field, says Tom Darden, one of the founders of Evmond. The trial was contracted out with a great deal of confidence in him, and he was managing that process. Saundra Pelletier was planning to teleconference into the meeting with the CRO and the FDA. But as her team was preparing, someone from the CRO arrived with news no one could have anticipated. The CEO of the CRO had decided to fly, piloting his private plane along with 2 of his colleagues. It turned out that he neglected to de-ice the plane, which led to his crashing into a house and killing everyone on board, and a mother and 2 children in the home. It was the most bizarre, shocking thing. Everyone at the FDA knew the people at the CRO, and they were all crying. Saundra Pelletier was stunned. 6 were dead, and among them were the only people who could help her understand the trial on which Amphora's fate seemed to hinge. That's when we started to be like, oh my God, this is very stressful and serious, she says. Standing still was not an option. Evfoam presented at a conference for investors, and it went well enough that by the spring of 2016, Saundra Pelletier had the company on a roadshow to raise $200 million in an IPO. She had written commitments for about half that amount and was confident she could raise the rest. But during that time, shares in Valiant were crashing over an investigation by the U.S. Securities and Exchange Commission. Prospective investors started getting spooked. Saundra Pelletier decided to pull the plug on the IPO, at least for now. Better to try again after FDA approval. Then, in April of 2016, Saundra Pelletier finally heard from the FDA. The verdict? It would not accept the Russian data, and therefore it couldn't approve the drug application in its current form. I was in shock, says Saundra Pelletier. I couldn't even process it. I thought, this cannot be happening. Saundra Pelletier has adjusted to life in perpetual uncertainty. Evfoam's headquarters, on the 6th floor of an office building looking out at the San Diego hills, is filled with indicators that she has no plans to get derailed. In Pelletier's office hangs a quote from writer Rebecca West, which reads in part, "I only know that people call me a feminist whenever I express sentiments that differentiate me from a doormat." It's one of 15 feminist quotes displayed throughout the company's office. Although building management made Pelletier remove most of the ones she put in the ladies' room on the grounds that they were too provocative for what is technically shared space. On an August afternoon, executives from both Evfoam and Women Care Global gather inside Pelletier's office for their monthly meeting. The conversation ricochets from startup issues like vendor payments and package design to ones that would sound more at home at an NGO, like the timing of grants from the U.S. Agency for International Development. While the two teams are wildly different operations, their goals are intertwined. If Amphora wins, Women Care Global could greatly increase its impact by, say, distributing the product across Africa to sex workers who need contraception that's acceptable to their clients and safe to use multiple times a day. Throughout the meeting, Saundra Pelletier pelted her staff with the same question. What else? What's left unsaid? They all know what's left unsaid. The possibility of failure, that no matter how much Saundra Pelletier and her team try to bulletproof the new Phase 3 study, Amphora still might not get approved. A little more than a year ago, on the day that Saundra Pelletier found out the FDA in-line image was rejecting Amphora's application, all she could think about was what she would tell her investors. She gathered her staff in Evfoam's boardroom with its framed pictures of Amelia Earhart and Malala Yousafzai and told them they had 48 hours to figure this out. Her team committed to having a Phase 3 trial design within 3 months. Saundra Pelletier and her CFO agreed to take pay cuts. She would have to lay off 6 people. Then there were the commercialization experts she'd hired, who now had no product to commercialize. If Amphora could get back on track with the FDA, these employees had the very skills Evfoam would need in 12 to 18 months. Saundra Pelletier told them she could find jobs for them at Evfoam in the interim. "If I do this," she told them, "and you don't really want to be here, I will hunt you down and torture you for the rest of my life." And they all stayed. Pelletier's investors didn't love the fact that they were looking at another trial, but they liked that it took Pelletier about 2 minutes to get back on her feet, says one, and agreed to back her plan. The new goal: FDA approval in 2019. Now, Pelletier is obsessed with controlling the outcomes of the new phase 3 trial. I say, every single day, let's control every single thing we know we can control. She says micromanaging doesn't come naturally to her. Her philosophy is to hire good people and let them do their jobs, except, of course, when she doesn't think they're doing their job well, professionally or personally. During a performance review of one senior employee, she told her she'd get fired if she didn't start dating online. She was complaining about not being in a relationship so much and not doing anything about it. "I just couldn't take it anymore," says Pelletier. Once the employee put up an online profile, Pelletier got a marketing consultant to rewrite it. The whole episode was creepy, except that it worked, and the employee is now happily married to someone she met online. Sandra is at the extreme, says Darden. She gets perfection in execution. With Amphora beginning its second phase 3 trial, Pelletier has indulged every control freak impulse. It could be done with 60 sites, but she's arranged for 115. She's enlisted her head of medical affairs to oversee the trial, even though it's typically tasked to a project manager level employee. When the study kicked off in June, Pelletier flew to Atlanta to talk to the people who would be working directly with patients, something CEOs almost never do. She doesn't imagine her new CEO loves all this meddling, but she doesn't care. They want this study to be over, Pelletier says. They think we're nuts. Seeming a little crazy is a small price to pay if it gets her to the only acceptable outcome. Though she easily discusses such uncomfortable topics as her surprise pregnancy, her divorce, and even FDA rejection, her voice cracks when she is asked what would happen if Amphora fails this trial. We're going to cut into a very brief break, and when we come back, more on Amphora and this phase 3 trial.
Are you tired of the same old news? Are you sick of the seemingly endless political spin and negativity? The GSMC America's Still Beautiful podcast is a weekly news podcast covering all the top positive and uplifting news stories. We cover stories that will inspire, uplift, and remind you of the good in the world. Tune into the Golden State Media Concepts America's Still Beautiful podcast to get all the great and positive news stories of today. Download the GSMC America's Still Beautiful podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
What's up, you guys? Welcome back to GSMC Health and Wellness Podcast. We are now entering the final segment in today's episode. We're going to wrap up this quick story regarding Saundra Pelletier, FDA talk, Amphora, everything, and we'll get more into the actual product. If the drug does not get approved, Pelletier swallows, there are options. Evofem might be able to survive by managing drugs developed by other companies. But Evofem would most likely have to sell Amphora, probably to a larger drug company that can market and sell it as a medicine to be used against STDs or bacterial vaginosis. Evofem would get paid royalties, and its investors would get some money back. Pelletier looks like she's going to quietly choke as she explains this. She would also offer her resignation. She says she did that when the FDA denied Amphora's application, but her investors don't remember it. They say that's possibly because it was the last thing they wanted. They were counting on her to turn this thing around, and if she did offer to resign, they say they dismissed the idea as quickly as they could. So, the quest for better control. There's been a lot of other options as far as a better birth control. Amphora isn't the only game in town when it comes to advancements in contraception. There's also Kaya Diaphragm, PATH, a global health nonprofit modernized the diaphragm, which once popular in the 1940s, had long fallen out of favor among women. The Seattle-based organization's diaphragm is latex-free, easier to insert and remove, and designed to fit about 80% of women. It's been on the market since 2015, the year after getting FDA approval. Then there's Cyanopress. Injectable contraceptives are the most popular form of birth control in some African countries, but using them requires regular access to doctors, a challenge in some regions. This one-piece injectable sold by Merck, which was made available in the UK and some EU and African countries in 2015, is already loaded, enabling women to administer it themselves. Then there's Gel. With the male birth control pill still a distant dream, Contraceptives gel might one day become the closest thing to it. The Charlottesville, Virginia-based startup is working on a non-surgical reversible alternative to the vasectomy, of which there are some 500,000 performed every year. Guided by ultrasound, a doctor can inject its gel into the vas deferens, where it solidifies enough to keep sperm from getting out during ejaculation. The early stage company, which has raised $2.5 million from investors, including Founders Fund, is currently doing animal studies, hoping to have a product on the market by 2021. Now, these are the other birth controls, but the one that Saundra Pelletier specifically designed and is actually out on the market is called Phexi, Phexxi, Phexi, and it's a vaginal gel. It contains lactic acid, citric acid, and potassium bertrite, and it is actually now FDA approved, hormone-free, most importantly, birth control. So, ladies, we're not going to experience those nasty side effects that we're used to with the pill or with the depot shot or with whatever method you choose or you have chosen for your birth control. And the name or the reason behind Phexi, so pH stands for the pH balance of the vagina, XX for woman chromosome, and then Phexi rhymes with sexy. So I think it's a really cute way or a cute play on words. Like I said, it's a new FDA-approved hormone-free birth control. Phexi is a non-hormonal prescription vaginal gel used to prevent pregnancy in females who choose to use an on-demand method of birth control. Phexi is only effective when used immediately before or up to 1 hour before each act of vaginal sex. Phexi does not protect against any sexually transmitted infections, including HIV. So that is something to consider. And it looks kind of like a tampon. So you put it in as you would like a tampon, and you dispose of the applicator. And it's really cool, honestly. It's a fresh take, if you know what I mean. So here are actually some possible side effects of Phexxi. In studies, less than 2% of women stopped using Phexxi because of side effects. Less than 2%. The most common side effects were vaginal burning, vaginal itching, vaginal yeast infection, urinary tract infection, vaginal area discomfort, bacterial vaginosis, and vaginal discharge. Women also reported genital discomfort, pain while urinating, and vaginal pain. Some male partners reported genital discomfort, including burning, itching, and pain. So avoid Phexxi if you have had repeated urinary tract infections or other urinary tract problems. You or your partner is allergic to any of the ingredients in Phexxi, or if you're using a vaginal ring. So that is really the most severe case of side effects. So again, that was in less than 2%. Less than 2%. So very low number. Like I said, this is a contraceptive gel that you use on demand. So you only use it right when you're about to get down. All right. So that's the thing with the typical birth control that we use nowadays. Women don't have sex every single day. So we don't need to be on birth control every single day. But it's designed that way, that we take every single day. As opposed to Phexxi, where you take it only on demand when you're about to get down. You feel me? So that is something really enticing. I like that it has 0 hormones. You're not going to experience those crazy side effects. And it's really quick, really easy, really simple. So I'm all for it. Again, it is Phexxi. Phexxi. You can look up more information on Phexxi.com if you are interested. And this is just so awesome that Saundra Pelletier really pushed for this. So thank you, Saundra Pelletier, for being, one of the leaders in women's health and really changing the way we think and feel about birth control. This is the future of birth control, guys. I hope you guys are excited, just as excited as I am. I definitely want to try. I'm going to talk to my doctor about it and about Phexxi. So you guys, that's going to wrap up today's episode here at the GSMC Health and Wellness Podcast. If you made it this far listening to my husky voice, thank you. I appreciate you for making it this far and not exiting out the first 3 seconds you heard my voice. If you guys enjoyed today's episode, please don't forget to like, share, subscribe, comment, all of that stuff, because that tremendously helps the show. And I'll catch you guys here for the next one.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network, from movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.